Hi, and welcome to Great Expectations. Today is our Ask the Doctor show, your chance to ask any mum or baby-related questions. But before we give you that chance, we'd like to hear what our broadcasting celeb mum, Leanne Manis, has to say about motherhood. Our healthcare professionals are gynecologist and obstetrician Dr. Daniel Mahapa and nurse and midwife Lorraine Rake-Spiegel. Welcome, everybody. Okay.
Thank you very much.
You're very welcome. Thank you for coming onto the show.
Pleasure. Thanks for having us.
Yummy, mummy. How has motherhood changed your life? I know, right?
It kind of like my life was like this way and now it's that way. So I think motherhood just, it turns it upside down, inside out, and makes it so much more fascinating, interesting, and more beautiful.
What are the highs and what are the lows for you?
I think every day is a high because the age that my son is now, he's 2.5 years old. So, I mean, every day, the words that come out of his mouth, the things that he's learning, the things that he's doing.
Like a little growth machine.
It's beautiful. It's absolutely amazing. I think the difficult part is the old age thing of being the working mom and trying to find the life balance between the two, being a good mom, being a worker, trying to be successful in your career and yet still providing. That's the tough one. That for me is the really, really tough one.
I know that you've got a new product out for all the mums and dads who are sitting at home, and you're pregnant as well.
I know, there's just so much happening.
There's a lot going on in your world, my friend.
Yeah. Firstly, the pregnancy. I'll put them in order.
Okay.
The pregnancy's good.
How
Loving
far are
it. 18 weeks today.
Oh,
so
wow.
So it's really exciting and looking forward to number 2. And don't know how I'm going to go from 1 to 2. No idea. But that's something I'm going to have to cross that bridge when I get there.
The ultimate freestyle.
Yeah,
hey?
exactly.
Yeah.
It is.
But you've put together this tool to help people through, hey?
Absolutely.
The first 6 weeks, huh?
Yeah, this is it.
Let's talk about it.
It's actually, well, how the book works is it's a book with a DVD.
Okay.
And it was put together by a production company in Port Elizabeth called Rooftop Productions. The book has been written by a midwife, and it's an outstanding tool that what you do is you watch the DVD, but at the same time you have got the book that you can also use.
Refer back to.
Exactly.
And what is it called? Where do we get it?
It's called the Antenatal DVD. It's available at bookstores from CNA Exclusive Books, Astoria Books around the country.
Okay.
And it's a great tool. I present the DVD side of things.
Fantastic.
Yeah.
Fantastic. Is it something that you wish you had?
Well, I really do. You know, when I saw the final product, because we'd worked on the product and I felt like I was doing a movie because I had no idea what the end product would look like. But then when I was sent a copy and I watched it, I thought, this is fantastic. I wish I'd had it just to be able to refer to, because you forget. This brain's like scrambled eggs when you're pregnant.
It's
you
true.
forget everything. And to just have this as a reference guide, it's amazing. And mothers don't have time these days to sit reading. So you actually just want to be able to quickly watch it. Okay, done, finished, move on.
And have something that you can refer back to.
That's it.
You've been through this before. You're going through it again. Is there anything new that you learned during the process of putting together this DVD?
Well, you know, I wasn't pregnant at the time of doing the DVD. So I actually was going through this whole thing, and you'll see there's a lot of talking on my behalf. There's a lot of, we go into hospitals, we go into maternity units, we go into pediatricians' offices, and it suddenly brought all these memories coming, flooding back to me. And at that time, my husband and myself were trying, and I was watching this and thinking, what am I doing to myself again? Do I really want to do this to myself again? Because it's just all these memories come flooding back to you of, you know, it is beautiful and it is the most amazing experience, but it's hard. At the same time,
hell of a hard.
it is
the
difficult.
Biggest challenge.
So it was a big learning curve for me as well to remember what it was all about. And here I sit, and we were chatting off air, and I was getting all the advice that I could from your experts that everyone's going to hear from later.
And you'll have a chance as well in the next segment to ask your questions directly on air.
It feels like my first pregnancy because I've forgotten everything.
No one prepares you for that.
No, they
There's
don't.
Is it as daunting the second time around?
You know, the one thing that I've noticed about the second pregnancy is you're not allowed to think about it because you already have you have your first child with you. So you're so busy with this child of yours that you forget that you're pregnant. And then then you sort of realize, oh, hang on. Somebody congratulated me the other day, and I didn't know what they were congratulating me for. I was like, what?
Did I win an award? What's going on?
And then they said, and you, oh, thank you so much. I know. Thank you very, very much. I mean, it's ridiculous. But you just are not allowed to think about the second pregnancy. And that's the difference between the two pregnancies, I've noticed.
It's so nice nice to see that a celeb mom goes through the same stuff that everybody else goes through. No one is immune to the chaos of motherhood. We've got an SMS from one of our viewers on the line. It reads, how do I induce my labor naturally? I'm now at 42 weeks. Wow. And I really want to give birth. Is castor oil a good thing to use? That's from Dudu in Soweto. I'd like to come over to Lorraine first.
No, castor oil is not a good idea.
Okay.
And at 42 weeks, it's already 2 weeks post-date.
Yes.
So the natural way, other than going into hospital for an induction, would be to get fairly active. A lot of walking.
Okay.
Squatting, movements like that, and the time-old favorite, and it works like a bomb, is sexual intercourse.
Oh, wow. Okay, so sex and get moving.
Absolutely.
Dudu. Daniel, would you agree with that?
I would agree, because with the movement and especially sex, you are, with the shaking of the membranes, you're producing little prostaglandins there. That sort of softens the cervix. We say it ripens the cervix.
Okay.
Then it keeps on effacing, later it dilates.
Why is castor oil a bad idea?
You know, castor oil is like pegatives and other things. It's like using a side effect to produce a thing. So you don't have
not getting at the
a
problem.
very titrated dose how labor is going to be, you know.
Okay, so it's not a good idea
It's
at
not
all.
a good idea.
Okay.
Because you might just have precipitous labor or it might fail. Nobody can guarantee it.
Okay, so have lots of sex, get moving, walk, go to gym, clean the house, squat, pick up somebody else's baby, a small baby, not a big one, a very small baby, but get moving. Leanne has very generously offered 3 sets of the antenatal guide for preggy moms this morning. So if you manage to get through with your question to our panel and you're a mom-to-be, you'll stand in line to receive one of these sets. So get calling right now on 011-447-1742. But right now, it's time for our Pampers Monday Minute with more of their good advice on skincare.
It's time for the Pampers Monday Minute.
The touch and smell of a baby's skin is so precious. And I've found that as a mum, if I look after and protect my son's skin, it just keeps that baby softness for much longer. There's nothing quite as traumatic as watching your baby go through a skin discomfort at an early age. That's why it's so important for us moms to take those extra precautions to ensure that we give our children the best skincare. My routine with Alexandro begins with a bath. And like most moms out there, I cannot resist putting cream on his skin to give him that extra protection. And I have found that a quality nappy that protects your baby helps keep him happy. Babies are always on the move, and as moms, we have to constantly find ways of protecting our baby's skin. Now, I know from experience that by giving your child the best, you will keep that baby soft skin for longer.
More baby care tips on your next Pampers Monday Minute.
Oh man, that's such a sweet, cuddly baby. Up next, we'll open our mailbox and our phone lines. So call us now with your questions on 011-447-1742 or send us an SMS on 34970. And please remember to type in ETV before your message. Welcome back. It's Ask the Doctor today, and we've got a great panel for you. We're giving celeb mom Leanne Manas the opportunity now to ask gynae Daniel Mahapa and nurse Lorraine Rakespiegel any of her own healthcare questions. Call us with your questions too. The number is 011-447-1742, or you can send us an SMS on 34970. Leanne, take it away. Do you have any questions?
Well, I do. I'm just gonna re-ask the question I asked you earlier, because I'm sure there's a lot of moms out there that feel the same way that I do. I know in a second pregnancy you feel the baby moving a lot earlier than you do in your first pregnancy. But when should you start feeling regular kicks and moves? And you know what? I'm sitting at 18 weeks, and you know I have it once in a while. Definitely not all the time. When should I start feeling regular movement?
When the baby's a little bit bigger. Remember, at the moment, the baby's still swimming.
Yeah.
You're sitting with something about that size, swimming around in a lot of amniotic fluid. And you will feel movement when it bumps up against the side of the uterus, because it's too small for you to still feel elbow and leg and stretching out movements unless it really does bump up against the side of the uterus. So a little bit later on when the baby's a bit bigger.
Okay. Have you decided on the kind of birth that you want this time?
Well, you know, I suppose I have been advised to go the Caesar route because my previous pregnancy, unfortunately, and I do say unfortunately, because I was looking quite forward to having a natural birth, but I couldn't. You know, my gynae did recommend on the day, I was in labour for about 7 hours, and I just was not dilating fast enough, and it was, my baby's heartbeat started just slowing down a little bit, and they said, look, let's get him out, because it's not, you are too narrow. So the advice that I've gotten is to go the Caesar route again, which I honestly am not looking forward to. But having said that, I just want to go the best option for whatever's good for me and for the baby. Yeah.
We've got some emails from some of our viewers. I'd like to ask the first question to Daniel. The email reads, is it normal to start your periods again a month after birth? And what is a normal flow then? Also, is it normal to have your cycle twice a month with a very heavy flow? And if so, why does it happen? Because it wasn't like this before. That's from Pindile.
Okay. Your periods, the time your periods could come, can range anywhere from 4 weeks to 12 weeks after delivery. Those who are breastfeeding, usually it's delayed a little bit because the contraceptive effect of breastfeeding with increased prolactin. But those who don't breastfeed, usually they got their period a bit earlier.
Okay.
So 6 weeks around there is not surprising.
Is it possible that what she's talking about maybe is post-birth bleeding, you know, the fluid that comes out? No.
I don't think it's possible because lochia will not stop and come back again.
Sure.
Post-birth bleeding is called lochia. Will gradually slow down and until it becomes just pinkish.
Okay.
That probably she stopped bleeding.
Yeah.
And now she's bleeding again, which I think is if your hormonal system is balanced again, she can start menstruating again.
Okay.
Coming on the second question, when a woman says I menstruate twice a month, one should be very careful because they take a month from the 1st to the 30th. And a normal period is about 27, 28 weeks. So if you menstruate on the 3rd and menstruate again on the 29th, she will say, I menstruated twice this month. So what you should do, you must count the interval between the periods.
I see what you're saying.
If the interval ranges between 22 days and about 32 days, that's a normal range. Irrespective of a month, because for a person out there, a month means March from the 1st to this one. So what a month means when they say monthly regulation, they mean lunar months. Every 28 days a moon comes. Those are lunar months. It's not calendar months.
So it's the time between, make sure that you count out 28 days.
Yeah.
Okay. And it can happen that it happened twice in the same month, but it's not 2 cycles.
It's not 2 cycles.
Got you. Leanne, I've got a question for you from Carla in PE. It says, how do you balance being a working mom? I cannot seem to get it right. I find I'm very unfocused at work and also really impatient with my 4-year-old. I can relate to that totally. What's your take?
I can relate to it as well. And I said that at the beginning of the program when you asked me what are the difficult parts and the good parts.
Being a working mother.
It's the top. I mean, we try our best as working moms, and it doesn't matter that I can be away. I mean, at this exact point in time, I'm busy thinking about my son, how he's doing. I know where he is, but I just want to know, has he had a good breakfast? Is he having a nap now? What is he doing? And I'm feeling guilty for not being there, but at the same time, I've got such a good infrastructure that I've put into my life, from my mom to my mother-in-law to the lady who works for me, that I know that he is being looked after constantly.
And he's loved.
Exactly, when I'm not with him, and I try as much as I can to be with him. Having said that, I maybe like, it's Carla, hey?
Yeah,
Carla out in PE, I need to work. I need the mental stimulation. And I think that by giving myself the mental stimulation, I'm being a better mother. And that's one way of looking at it. Can you stay at home all day and be a mother? I respect women that are able to do that so much. I'm just not one of them that wants to do that. I need to have the stimulation outside, that when I get home, when I'm with my son, it's all about my son. It's about him, and that's what's important.
Do you have any more questions that you'd like to ask maybe Daniel before you run off? Because I know we've only got a couple of minutes with you.
I suppose I've got so many questions, but you know,
fire away.
Here's one question, and I was trying to find it. Is it normal to have so many headaches in pregnancy? Because that's something that I'm really finding. I never noticed it in my first pregnancy, but this one, I've just got these annoying little headaches all the time. Is that a normal side effect?
I wouldn't say it's normal, but I say it's common.
It's common, okay.
It could be normal. Headache can never be normal. But
What
depends,
causes the headaches?
that's why I say to say the headaches, you've got to classify it. Usually what women have, they've got tension headache. As you say, you don't know what to expect. You keep on perpetually thinking about this. That's the common thing. It gives you tension headache, which is bitemporal headache with stiff necks. And the other thing that gives women headache is relative dehydration. They are not dehydrated, but relatively dehydrated, because during pregnancy you've got this increase in body volume. But if you don't replenish enough fluid, enough to accommodate for physiological increase in body volume, you've got what we call relative dehydration of the central nervous system. That's why I encourage to keep on replenishing your body
Lots
volume.
of water.
You realize that you go to the loo more often
Yeah.
to excrete. That way you make yourself dry in the
So you need to drink a lot more water.
You need to drink a lot
Even
of
though you're
advice.
running to the toilet twice as much as everybody around you anyway, you
Yes.
still need to drink
You-
more water.
You've got to replace what you lose.
But you know, it's also challenging because I mean, you're not allowed to take normal medications. You know, when you're pregnant, you can only take very mild medications, and even that in small doses. So, what does a mom do if she is experiencing headaches? What can she take?
What you have, a pregnant mom, there are two people there.
Yeah.
The mom has got a headache, the baby doesn't have a headache. So when you take medication, you must make sure that you don't treat the well one also. So the treatment that you take must be is such that it will not have deleterious effect on the baby.
Yeah.
Because actually what more interested in is the baby. The mother is just a carrier. So there are some medications that are proven to have adverse effect on the baby. So that will be out during pregnancy. But there's relatively few that are tested in pregnancy that you can take for headache.
I found that my headaches went away as time went on. By the time I hit about 6 months, they were gone. Is that normal? Should Leanne anticipate experiencing these headaches until like the 3rd trimester?
That's why I said it depends what kind of headache you had. Suppose you had a tension headache.
Yeah.
Early in pregnancy, adjustment disorder, you didn't know what to do with the first baby. By 6 months, you're sort of a mature pregnant woman. Then they go away.
Got you.
Does a good massage help?
Yeah.
That I have to.
I was gonna
Can I
suggest
go
that.
for? Why do they say that you shouldn't go? Because are some oils bad for you? Can I
you
have a
must
massage?
be careful with aromatherapy oils. There are a lot of oils that are contraindicated in pregnancy, and anybody can just go on the internet and find those.
Okay.
There's a whole list of them. So yes, go to somebody who's experienced in pregnancy massage rather than somebody who isn't, because they would know. And a good massage of your upper back, neck and shoulders, even in a sitting, look, you can't lie on your tummy, obviously, if it's big. But you can sit and have an upper back, neck and shoulders, and I would have it done regularly. And yes, push fluids. And another a word of advice would be tissue salts. You know, people negate the value of tissue salts. Mineral salts, easy to absorb through the mucous membranes of the mouth. There's lots of them out there on the market. And they are safe. Most of them are safe to take. I mean, magnesium, calcium. But you get a sort of a tissue salt that's a magnesium combination.
Magnesium and calcium, are they specifically for headaches? Will they help with that?
No, but they magphos is what it's known as, magnesium phosphate. And what you do is you can take, you can dissolve the tissue salts in a little bit of water and take sips of water, and you can take quite large doses, and you can use rescue remedy. It works. Great. Honestly, it works.
We've given.
Physiologically, how
Go ahead.
it would work, it will increase the osmolality of the
Yes, it
fluid.
will.
So you'll
It does.
keep more fluid intravascular than extravascular. As I said, you are hemodiluted. That's why you've got diuresis. You lose a lot of fluid through the kidneys. So it keeps the fluid inside.
It helps the body
and
to
those
hold
what
on
he
to
has
that
said
water.
is mostly, I see more modern pregnancy supplement. They've got all this in one tablet. They've got magnesium, phosphate, iron, zinc in one tablet, so you don't have to take 5 tablets at the same time.
Very valuable advice there. It's been such a pleasure having you on the show. We ran
you for
over
having
because
us.
we don't want to say goodbye to you.
Thank you so much for having me. I'm going for a massage now.
Fabulous. Please, we would love to see you again before
We will.
you pop.
Definitely. Thank
and
you for
thank
having
you
me.
so much for the box sets. I
It's
think
a
our moms
pleasure.
will appreciate that a
I really
lot.
hope they like them and just to help you through your pregnancy, because that's what it's all about. We need all the help we can get. But thanks, Lebo. Thank
Congratulations on all
Thank
your
you.
impending projects.
you. Thank you. Thank you so much.
Have you got a question that you need answered? Give us a call and ask our panel on 011-447-1742, or you can send us an SMS on 34970. Hi, you're with us on Great Expectations, and today is our popular Ask the Doctor show. With us is nurse and midwife Lorraine Rake Spiegel, who can help you with any concerns about your baby, such as reflux, weight gain, or stuffy noses. Our gynae and obstetrician is Dr. Daniel Mahapa, who can help you if you have concerns about fertility, episiotomy care, or any other gynecological concerns. SMS us your query now on 34970. And I believe we've got a caller on the line. I'd like to say welcome to Mahau from Pretoria. Hello, Mahau.
Hi.
How are you?
I'm fine, and you?
Fine, thank you. Thanks for calling in. Fire away with your question, please.
Oh, yes, I have a question.
Yes.
You see, I'm 14 months pregnant, ne?
You're how many?
14 weeks.
14 weeks pregnant. Okay, yes.
Yes. But I can't seem to stop vomiting. Like, I'm still nauseous. It's like difficult for me to eat. I can't eat. I can't keep anything down except for water.
Okay.
And I have this constant headaches like that. They really want to kill me. I just go to bed when I have one of those. So I was just wondering, when is the nausea gonna stop?
I understand. Did you manage to listen to the previous segment where we spoke about headaches and
Yes,
staying
I
hydrated?
did.
It makes a lot of sense, though, that you'd be feeling like that, especially if she's vomiting. That means that she's losing the fluids all the time.
She's dehydrated.
I felt you nodding furiously, Lorraine. Please, can you give us some advice?
No, I was just hearing. Look, the thing is she's getting dehydrated.
Yeah.
The fact that she's vomiting all the time and is nauseous, she's probably not drinking enough.
Yeah.
So, Mahau, you need to drink a lot of water, and we need to try and keep it down. Dr. Daniel can probably answer your question better than I can as to when this nausea is going to stop and if it will.
Yeah.
Okay.
14
but I
weeks
tried to drink
is a bit
as much.
late
You
for
see
it. Should
those
have
Tupperware
stopped.
bottles, those 500 ml ones.
The 500 mils of?
Bottles.
Oh,
I make sure I drink at least 5 a day.
Oh, I see. She's drinking. Okay, so she drinks 500 mils 5 times a day of water. So she's getting about 2.5 liters of
She is
water.
getting enough.
Listen on the line, Mahau. We're going to try and give you some advice, Dr. Daniel.
At 14 weeks.